this G89 code when a provider, every time the provider uses his RX number, you want to make sure that you assign the G89 code because it provides some kind of a legal protection to the provider to make sure that when they dispense pain medication, it reflects in the patient's chart that the patient is truly need that pain medication. Okay, so that's the importance of this G89 code. Category G89 codes are acceptable as principal diagnosis or the first listed code when pain control or pain management is the reason for the admission. Okay, example, patient with displaced intervertebral disc, nerve impingement, and severe back pain presents for injection of steroid in the spinal canal. The underlying cause of the pain should be reported as the additional diagnosis if known. Okay, so what basically is being talked about here, guys, is understanding what is the reason, what's the purpose of patient's visit. So obviously, if a patient goes to a pain clinic, patient is seeking treatment for to diffuse that pain, right? So I mean, like it does make sense, right? So the main reason why a patient is the pain clinic is to have to get that pain addressed, right? So if that is the case, that the patient is seeking pain management or to control that pain, the primary diagnosis has to be that pain code, the G89. Okay, and whatever that is causing pain, like the herniated disc or anything, or lower back pain or whatever that's causing the pain, should be added as the secondary diagnosis. So just remember, guys, that you only assign G89 code, okay, as your primary diagnosis or principal diagnosis if the main reason why a patient is in the clinic is to have that pain controlled or have that pain managed. Okay, so that's what is important to remember, okay, in the sequencing guidelines. When a patient is admitted for the insertion of a neurostimulator for pain control, assign the appropriate pain code as a principal or first listed diagnosis. When an admission or encounter is for procedure aimed at treating the underlying condition and a neurostimulator is inserted for the pain control during the same admission encounter, a code for the underlying condition should be assigned as a principal diagnosis, and appropriate pain code should be assigned as a secondary diagnosis. Okay, so when the patient goes to the clinic and have a neurostimulator inserted into the patient's back, okay, vertebra, okay, your primary diagnosis has to be the pain, again, because the purpose of the visit is to have that pain controlled, right? So if a pain control neurostimulator device is inserted, then obviously your pain code should be the primary diagnosis. However, there was a follow-up statement there that if a patient came in for a procedure, okay, let's say for instance, patient has a chronic back pain, and what's causing chronic back pain is a displaced disc. Okay, so in our spinal cord, guys, spinal vertebra, we have different discs at different levels, right? So if that disc is displaced, like it's protruding, it will cause a lot of problems, because inside our spinal canal, okay, inside a spinal canal is a nerve that goes through the canal, and that nerve, guys, is the one that basically dictates if a patient is in pain or not. Okay, so I mean, in a more simplistic way, that nerve that runs through the canal, guys, if it's displaced, if it's pinched, if it's it's not in this in the right angle, right position, then it may cause it may cause a person to experience back pain. So if that disc, is displaced, it will definitely, put the nerve, of course, touching those walls, right? So when that happens, it may cause pain. Now, again, if the reason for patient's admission is to get that vertebral or the spinal issue get fixed, right? So whatever that condition, the underlying condition that makes it difficult for a person, like the herniated disc, it was mentioned in the guidelines that you have to code that as your primary diagnosis, and if the neurostimulator is added during the operation or was also inserted during the operation, then the neurostimulator or the pain code should be assigned as your secondary diagnosis, right? It's not actually contradictory to what we have discussed earlier, that if a neurostimulator is inserted, then that should be the primary diagnosis. No, it's not contradictory. What is being talked about here, explained to us, is that if a neurostimulator, guys, is a device that controls the pain, okay, is inserted alongside with a procedure to fix that what's causing the back pain, then your pain code should be coded as a secondary diagnosis. Okay, so I hope that's not so confusing to you guys. Okay, so what the biggest takeaway here is that you need to identify first what was causing patient's pain. Okay, if what's causing patient's pain is something that can be fixed, and when the visit is about that fixing that condition, then that condition that is causing the pain should be your primary diagnosis. Okay, the only time you assign the G89 code, the pain code, as your primary diagnosis, if there was nothing done, okay, there was no procedure, but the main thing that the doctor performed is to just kill the pain. Okay, just to address the pain, giving the patient some relief. Okay, so your primary diagnosis will be the pain code. Okay, so I hope that gives you a little bit more of clarity of what the guidelines were trying to say. Any question, guys, so far? Okay, so let's go to the next one. Category G89 codes in conjunction with site-specific pain codes. Okay, let's read this. Assigning category 89 and site-specific pain codes. Okay, codes from category G89 may be used in conjunction with codes that identify the site of pain. Okay, if the category G89 code provides additional information, for example, if the code describes the site of the pain but does not fully describe whether the pain is acute or chronic, then both codes should be assigned. Okay, so what does it mean, guys? So example, let's say, for example, patient has acute or severe osteoarthritis of the hip. Okay, and the doctor documented severe osteoarthritis of the right hip, and that is causing, of course, hip pain and back pain, right? And in many cases, guys, a severe osteoarthritis, doctors usually just give a patient like an over-the-counter medication, OTC, okay, over-the-counter medication, Tylenol or Advil or something that helps the patients get relief from that pain, right? But If the doctor did not specify whether this is acute or chronic, then what the guidelines are saying, you can actually also use the G89 code alongside that osteoarthritis type of osteoarthritis how to call it, the issue, okay, problem. So osteoarthritis causing hip pain, okay, you can assign G89 if the doctor said patient is having hip pain because of osteoarthritis. So that is what we call site-specific pain, and you also assign a G89 code because obviously when the patient comes in for a relief of that pain, then a doctor would give and the doctor give some pain medication. The G89 code should also be assigned. Okay. Now how do we sequence it? Well, okay, the sequencing of category G89 codes with site-specific pain codes is like this, okay? It's dependent on the circumstances of the encounter admission as follows. If the encounter is for pain control, then the G89 assign the G89 followed by the code identifying the specific pain site of pain for acute neck pain from trauma code. Anyone has a question? Okay, so let's read again. If the encounter is for pain control or pain management, assign the code from category G89, okay, as your first listed, followed by the code identifying the specific site of pain, okay? For acute neck pain from trauma is assigned code G8911, acute pain due to trauma, followed by the M542, which is cervicalgia, to identify the site of the pain. So again, guys, depending on the circumstances, if the pain is site specific, like the doctor had specified where that pain is coming from, okay? If it's like the example here, if a patient is having neck pain, which is cervicalgia here, and the reason why patient was admitted to the clinic is to have to receive a pain medication, okay? Then you assign the pain medication first, code, the pain code first, G89, followed by your neck pain code, M54.2. If the encounter is for any other reason except pain control, and the related definitive diagnosis has not been established by the provider, assign the code for the specific site of pain first, followed by the appropriate code from category G89. So you see here, guys, the guidelines are consistent with, that basic basic instruction saying that if it's not about pain, okay, if a person's admission to the clinic is, is not chiefly to administer pain control or pain management, the pain code should be assigned as secondary. But if it's about administration of the pain medication, okay, or any pain management modality, then the pain code should be assigned as the primary diagnosis. So it's very consistent. I mean, you just need to understand, why is the patient in the clinic? Is it to have a pain pain management session or pain control administration? If that is, the G89 code should be assigned as your primary diagnosis. What about pain due to devices, implants, and grafts? Let's look at this guidelines, guys, and let's read this, okay? The provider's documentation should be used to guide the coding of post-operative pain, as well as in section 3, reporting additional diagnosis. Okay, so the default for post-thoracotomy and other post-operative pain not specified as acute or chronic is the code for the acute. Okay, so if there was no documentation saying this is chronic or acute, or the doctor just plainly reported patient is having post-operative pain. So the guideline said you have to code it as acute post-operative. Okay, that's the default. Same with post-thoracotomy. There is a specific pain code for post-thoracotomy, guys. And what is a post-thoracotomy? Does everybody understand what that procedure is? A post-thoracotomy, guys, is a procedure. This is a stage, or this is a period during operation. The patient comes out from the procedure, from an open chest surgery. Okay, so post-thoracotomy means after the patient had an open procedure, open heart, open lung, okay, anything that that has to do with that kind of procedure, okay, and the patient is in acute pain. That's what we call post-thoracotomy. Okay, thoracotomy means there was an open chest type of procedure is necessary to be able to fix that problem, whatever problem this patient have. Okay, so that is what post-thoracotomy means. Okay. Now, what does the guideline say about that? Okay, the acute should always, the default should always be acute. Okay. Routine or expected post-operative pain immediately after surgery should not be coded. Okay, after surgery, the immediate period, okay, it is but normal for a patient to, of course, to experience pain, right? It says here a routine post-operative pain should not be coded, okay, after surgery, because it's but normal to a person to feel pain after a chest is surgically operated or removed, or not removed but open, right? So do not assign a post-thoracotomy pain immediately after the procedure. This is only after a patient, say for example, patient is already recovering and patient has already been discharged and patient still feels that pain, acute pain, then that is the time when you have to assign a code for a post-thoracotomy. Okay. Post-operative pain associated with specific post-operative complication. What is this? A post-operative pain associated with a specific post-operative complication is assigned to the appropriate code found in Chapter 19, injury, poisoning, and certain other consequences of external causes. If appropriate, use additional code from category G89 to identify acute or chronic pain. Okay, so what does this mean? Okay, so there are times, guys, patients after a procedure and say was discharged the following day to the patient's residence, and for some reason patient is experiencing pain because of that device or because of that say equipment that was not equipment, is that a right word there? Device, let's use device. Okay, that was inserted or that was part of the procedure and patient is experiencing pain for that. Very very common to this type of scenario, guys, are those hip replacements, knee replacement, right? And I see this a lot. The patient continues to feel pain even after a few days or sometimes weeks, sometimes months after the procedure. Patient still feels pain. So this is an example of patient having pain due to a device. Okay, the guidelines say that sorry, the guidelines say that you are to assign a complication code due to device, okay, or pain due to device and if necessary, assign also a G89 code, you know, if it's acute or chronic pain. Okay, so what is this? How do you look for a code for pain due to a device? And I will show you guys how to do it. So everybody, please grab your book, okay? And let's go to the term pain, okay? Everybody, please do that. Let's go to the term pain. All right. And after you found the term pain here, guys, let us scroll down and go to the indentation that says due to device. Yes, it's page 255. Thank you, Karen. In 2024 book. Due to device, you see that due to device, implant, or graft, okay? And now you need to identify what device that is. Let's say, for example, let's use that scenario that we had on the board earlier, which is hip replacement. A patient having pain due to a prosthesis that was used in hip replacement, okay? So what are we going to look for now? We're going to look for the joint, right? Due to device, okay, of a joint prosthesis. You guys see that? Due to device, then joint prosthesis. What code do you guys have? So yes, Brittany, the code that you guys have here is T8484, right? So let's write it down, T8484. Now, if you check the tabular, tell me guys what other instructions you see. T8484. Let me fix my code here. Back, I'll put that here. T8484. This is not a complete code. So how do you determine the complete code, guys? Go to the tabular and tell me what should be done. Initial encounter, yes. So put initial encounter. So that's going to be a default for now, okay? Everything now should be initial encounter. Okay, Christine, you have T8484XA. And does everybody agree with Christine's code? Yes, okay. So Brittany, you agree, and the rest of you guys should agree, because this is how you're going to code this T84.84. This is pain due to a device. Again, guys, thank you, Karen. Thank you, Irene, Brittany, for confirming this. This is how you assign the code for any pain, guys. If a patient is suffering of pain because of something that is inserted into the patient's body, and that device is causing this discomfort or this pain, okay? So this is how you look for that code. So always go to pain, due to device, and then identify what kind of device that is. If it is due to a circulatory device like a stent, or if it is a wire, is it an orthopedic device? Is it something else? Is it for joint? You have to identify, because there's a specific code for a specific source of pain due to device. Okay, and I must admit, these are one of those. I mean, these are a part of or part of the codes that are really challenging to look for. Okay, if you don't know the guidelines, how to look for this specific type of pain codes, you're gonna get lost. And that's why I'm showing you now, guys. If that is the scenario that you are confronted with, like patient is having pain because of that prosthesis, because of that wire, because of that plate, because of that rod, okay, because of that stand, then this is the way you look for that code. Okay, and we're only talking about pain, right? If we talk about something else like complication or infection or something else, it's a different way to look for the code. Now, any question from what we did here, guys? So we now know how to code due to device, pain due to device, right? And also, again, the guideline said you can assign also the G89 code if patient is in acute pain, okay? G89, either 18 or 28, right? If this is post-operative, pain, acute post-operative, then you can assign the G89 18, right? But if it's not post-operative, like it's like long time ago, then G89 28. The difference between 18 and 28 is the 18 is, I think it is post-operative. Okay, the 28 is other chronic pain. Okay. Okay. Let's go back to the guideline here. Chronic pain is classified to subcategory G89-2, which we have already identified earlier. Okay. There is no time frame defining when pain becomes chronic pain. The provider's documentation should be used to guide use of these codes. Okay, so there's no time frame. If a patient is chronic pain, chronic means that is something that does not go away. Okay, so there's no time limit. But of course, the doctor has to document that pain. Okay. Now the neoplasm related pain, which I have talked to you about before, guys, is really a huge deal. Please make sure to remember this code G89.3. In fact, if I were you guys, I'm going to highlight this. Okay, what G89.3 is for? It is assigned to pain documented as being related to or associated or due to cancer, primary or secondary malignancy or tumor. This code is assigned regardless of whatever the pain is, acute or chronic. This code may be assigned as the principal or first listed code when the stated reason for admission encounter is documented as pain control, pain management. The underlying neoplasm should be reported as an additional diagnosis. Okay, so I think I talk about this very briefly, guys, that the specific code for a pain associated to neoplasm is G89.3. Okay, remember that. Multiple times that I heard from people who took the test that they have encountered this code. Okay, G89.3, which means that any pain-related neoplasm, okay, or any neoplasm-related pain, okay, should be assigned the G89.3 code, regardless of the sequencing, okay? If the reason for patient's admission to the clinic is to have that pain controlled or to have a pain management type of visit, then the G89.3 should be the primary diagnosis. But if the reason for the visit is for neoplasm, and then patient was also given pain medication for pain, then the G89.3 should be assigned as secondary diagnosis. So we always go back to that basic principle of whatever the reason for patient's visit, should be assigned as the primary diagnosis. Okay. And last in this guideline, guys, is chronic pain syndrome. What does this chronic pain syndrome is about? Central pain syndrome, G89.0, and chronic pain syndrome, G89.4, are different than term chronic pain, and therefore code should only be used when the provider has specifically documented this condition. So what this means, guys, is that you only assign G89.0 and G89 or G89.4 if the provider has documented verbatim, okay, that patient is in chronic pain syndrome, or patient has chronic central pain syndrome, right? Or chronic pain syndrome. Very rarely these codes are used because most doctors do not document that way. Okay, most doctors are very specific to their reporting. If a patient has a pain, then the doctor will document where is the site of the pain. Okay, if you have the site of the pain and you have the reason why patients is having that kind of pain, then you know what to do, right? The definitive diagnosis should be assigned as your primary diagnosis, okay? And if there was a pain management done or administration, then the pain code will be assigned as secondary diagnosis. Okay. All right, so any question, guys? We have finished the whole chapter 6. Any question from this entire chapter? Anyone? Okay, I think I think it's clear to everyone. If it's not, then again, like what I always advise you guys, continue to reread the guidelines. And if you encounter something that's not clear to you, then bring it up to our class and we'll talk about them. Okay.